Let's jump right into this explainer because today we're exploring a truly fascinating intersection in modern medicine. On the one hand, we've got the absolute breakthrough of modern weight loss drugs, those incredible therapies dominating the headlines right now. But on the other hand, we have the foundational gut healing power of traditional medicine and microbiome science. So what happens when you bring these two completely different worlds together? Well, we're looking at a brilliant new source document that explores exactly that, how a biological support platform called LiverSlim 3xBiotics is actually designed to synergize with intense metabolic treatments. Okay, let's dive into this. We really have to understand that the new generation of incretin-based therapies, we're talking molecules like Ozempic, Mounjaro, and more recently Retatrutide, are fundamentally shifting the therapeutic paradigm. We're moving way beyond this simple concept of basic weight control here. These new molecules, especially Retatrutide, are now being considered true master metabolic regulators. They don't just tackle weight, they exert broad, really profound effects on severe obesity and an entire web of systemic comorbidities connected to it. So here's our roadmap for today. First, we'll cover master metabolic regulators. Second, the hidden adverse effects. Third, enter LiverSlim 3xBiotics. Fourth, ancient roots and modern science. And finally, the integrative protocol. Section 1, Master Metabolic Regulators, a true modern medical marvel. And this brilliantly illustrates the massive list of serious comorbidities these modern therapies can effectively target. Modern GLP-1, GIP, and glucagon incretin therapies are literally performing systemic renovations on the human body. We aren't just talking about dropping a few pounds or managing type 2 diabetes, non-alcoholic fatty liver disease, and metabolic syndrome. Look further down. They're impacting everything from obstructive sleep apnea and cardiovascular and renal diseases, all the way to neurodegenerative disorders and certain autoimmune conditions. It's a massive, multi-system impact. But as with any massive intervention, there's always a biological cost. Which brings us to Section 2, the hidden adverse effects, the biological cost. We really need to shift our focus here, because this profound metabolic efficacy doesn't just happen in a vacuum. We're seeing frequent reports of intense gastrointestinal distress. We're talking nausea and vomiting, gastroparesis, which is delayed stomach emptying, and hypochlorhydria, meaning low stomach acid. Patients are experiencing alternating diarrhea and constipation, metabolic endotoxemia, leaky gut syndrome, and even biliary stasis that can lead to gallstone formation. This is the biological expression of continuous, intense stimulation of those incretin receptors. The system is just being pushed to its absolute limits. Now, what's really interesting about this slide is the stark contrast it presents. On the left, we've got the highly desired wins, profound weight loss, improved insulin sensitivity, and a great reduction in post-meal blood sugar spikes. But on the right, we see the hidden, deeper costs of this intense receptor stimulation. We are looking at the potential for sarcopenia, a dangerous reduction of muscle mass. We see fatigue, mitochondrial dysfunction, dysregulation of the hypothalamic pituitary adrenal axis, and crucially, the very real risk of actually reducing the physiological sensitivity of the exact incretin receptors these drugs are targeting. It's receptor fatigue. So, this leaves us with a pivotal, absolutely critical question. How do we protect the body during intensive incretin therapy? I mean, if the receptors are being bombarded and the gut microbiome is in total distress, how do we build a support system that actually allows the patient to reap the benefits of the medication without paying such a steep biological toll? Section 3, enter LiverSlim 3xBiotics, the biological support. Let's move to and see how this builds out the precise biological chain reaction triggered inside the gut. Based on the urgent need to alleviate these adverse symptoms and support homeostasis, ProNatura developed LiverSlim 3xBiotics. It acts as a biological support bridge or a scaffold for patients undergoing heavy metabolic renovation. Step 1. The patient ingests fermented adaptogens. Step 2. These specific fermented botanicals stimulate the formation of short-chain fatty acids right there in the gut. Step 3. This process modulates TGR5 bile receptors, which are key sensors directly involved in regulating energy and inflammation. And finally, step 4. This endogenous mechanism actually boosts the body's physiological, natural secretion of GLP-1, GIP, and glucagon. It's achieving convergent results to the drugs, but doing it from the inside out. Section 4. Ancient Roots, Modern Science. Now, you might be wondering, what exactly are these fermented adaptogens?
Well, we're looking at plants traditionally used in Chinese medicine, herbs like schizandra, Poria cocos, Scutellaria, berberine, and Mamortica, which have been used to treat complex metabolic imbalances for centuries. But here is the modern twist. Through targeted fermentation processes, we've vastly increased their bioavailability, greatly enhanced their pro- and postbiotic potential, activate lipid oxidation, and stimulate AMPK enzymes. Essentially, we're fermenting ancient medicine to create incredibly potent modern metabolic tools.
So, the crucial point is this. Intestinal dysbiosis and a disrupted microbial ecosystem represent the true common pathophysiological core of obesity, insulin resistance, and systemic metabolic disorders. If you don't address the gut flora, you're really only treating the symptoms of metabolic disease, right? Not the root cause. Fixing the intestinal ecosystem is the vital missing link in modern metabolic therapy. Section 5. The Integrative Protocol, the Daily Life Blueprint.
Understanding the science is great, but how does this actually translate into a holistic blueprint for your daily life? Here are the actionable, grounded steps. The protocol recommends taking the 3xBiotics daily, specifically before main meals. It requires maintaining optimal hydration, engaging in moderate physical activity, and eating a balanced diet with a strict focus on adequate protein to fight off that sarcopenia we mentioned earlier, and getting adequate fiber to feed your microbiome. But perhaps the absolutely crucial element here is complementary use. This is designed to support the digestive tolerance and metabolic balance of individuals undergoing modern incretin therapies. It definitely does not replace prescribed medical treatments. Rather, it acts as a protective, synergistic companion to them.
As we wrap up today's explainer, I really want to leave you with this final thought-provoking question. When we look at the incredible power of modern metabolic drugs, and we contrast that with the foundational gut-level healing of fermented adaptogens, we have to ask ourselves, are we just forcing a result by hammering our receptors, or are we truly healing the system from the inside out? By synergizing breakthrough pharmacology with microbiome science, it seems we might finally be able to do both. Thanks for joining me on this deep dive. Catch you next time.